Good Friday afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director of the Knox County Health Department. I know Charity's usually up here, but she's taking some time off today, so you got me. Our moment of gratitude today is dedicated to all of the individuals who have come to the Knox County Health Department for testing. Recently, the volume of folks wanting to be tested at KCHD has increased. We're thankful for everyone being patient as our testing teams work as quickly and thoroughly as possible to move people through the line. We continue to ask that if you come to the health department for testing, please wear a mask and maintain physical distancing while waiting. Regarding testing next week, because it's a short week with the holiday on July 3rd, we will offer testing at the health department from 8 a.m. to 2 p.m. Monday through Thursday at 140 Dameron Avenue. That schedule may change the following week because we're back to regular 5-day-a-week stuff. Before we talk about today's benchmarks, I want to remind you that the next Board of Health meeting will take place on Wednesday, July 1st from 5 to 7 p.m. The Board of Health will continue to meet every other week during the pandemic. During these meetings, they will review the benchmarks. For that reason, we are changing when we report our benchmarks to ensure the Board of Health is looking at the most up-to-date data when they meet. We will continue to update our benchmarks weekly, but next week, we report our benchmarks on Wednesday instead of Friday. Moving forward, once the Board of Health has determined a regular meeting schedule, we will consistently report our benchmarks on a day of the week that they designate. Before we get into today's benchmarks, we will begin with our local situation. We have 807 confirmed cases of COVID-19 in Knox County. Additionally, we have 27 probable cases. 605 of our cases have recovered, giving us 197 active cases. 60 individuals have been hospitalized at some point in, 67 individuals have been hospitalized at some point in their illness. We currently have 12 Knox County residents hospitalized. We are thankful to once again be able to report we've had no additional COVID-19 related deaths in Knox County. Now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day, we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we're trying to see, are things staying the same, getting better, or getting worse? And if so, how much better or how much worse, and at what rate? Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. Since the beginning of this week, we have experienced red level flags on 5 consecutive days. These increases caused us to represent this traffic light as red. This is a concerning trend and further reiterates that the virus is still very present in Knox County. What we want to see moving forward is the new cases becoming more stable and leveling off. Slow, steady increases allow us to have cases recover and roll off the active case list, and at around the same time as new cases are being added, keeping that kind of steady. However, when we experience spikes, especially when they are sustained, the active case counts jump up quickly. Cases are being added to our active case count at a higher rate than they are rolling off currently. We know we are going to see new cases every day. It's unrealistic not to see growth as we reopen. This is why we continue to stress the importance of following the 5 core actions. These actions alone won't completely eradicate COVID-19 from our community, but they will help significantly to slow the spread. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs. One that shows a sample of the tests conducted for Knox County residents, and another for the average time between specimen collection and lab report data. This week, this benchmark is represented as red. We want to provide a little bit of background on this one. The first graph shows that the number of tests conducted has decreased in a statistically significant manner. However, we understand that the statewide reporting system is likely experiencing a delay in recording negative tests. Therefore, data is demonstrating lower numbers than are actually tests being conducted for this time period. And to be clear, there is not a delay in reporting positive cases. The system is designed for positive cases, and we've talked about before, it's not really designed for negative cases, for reporting of negative cases. Anecdotally, through what we are hearing from hospitals and private providers, including our own testing at KCHD, testing looks to be in good shape and consistent with previous weeks. Because of what we can see at this point in the statewide system, this graph is represented as red. For the second graph, we're seeing some statistically significant changes that show a longer turnaround time for results, which leads this graph to also be represented as red. However, it's important to note that because the numbers are so low to begin with, even a small change can register as statistically significant. The trend for this graph is still in the direction we want to see it going. For example, with small numbers, even going from 3.67 last week to 4.62 this week registers as statistically significant. Some of that slowdown may be due to larger volume of testing that's been going on across the state. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to reach out to cases within 24 hours and close contact within 48 hours. To date, throughout this pandemic, we've accomplished that for all of our cases and contacts. Because of that, this benchmark continues to be represented as green, and I'm grateful for that and grateful to our team for accomplishing that. As a quick note, we are bringing in and training more individuals to assist our EPI support team and build our local contact tracing capacity beyond our internal team, as we've spoken about before. However, that said, our current team was able to contact cases and close contacts within the ideal time frame of this benchmark for this week. The fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories as well as COVID positive patients and patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, East Region, or patients from other jurisdictions. For this benchmark, the traffic light remains green. While we did experience a few days of statistically significant increases regarding positive patients, ICU patients, and ventilated patients, we spoke with our hospital partners and they stated their benchmark should be represented as green because they are still well within their capacity to respond. As we've mentioned, since the numbers are relatively low, even small increases register as statistically significant. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as talking about the data and taking the data into consideration. However, we do want to note, while the numbers of COVID patients in the hospitals are relatively small, they are continuing to trend up. We are watching this very closely. It again demonstrates that the virus is still very present in our community, which is another reason we continue to recommend and encourage the 5 core actions to reduce the spread of disease. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we show the chart that details cases, hospitalizations, and deaths. This benchmark remains green because we thankfully have not had an increase in deaths related to COVID-19. Now I'll open it up for questions.
All right, you can go ahead and submit your questions into the chat feature, and please remember to type in your name as well as the media outlet that you're affiliated with. All right, so first question we have is a couple from Alan Sims with Inside Knoxville. His first question is, would you clarify information regarding restaurant workers? I understood Charity to say in Wednesday's briefing that a restaurant worker who has tested positive for COVID-19 but shows no symptoms can report to work as long as they wear a mask, even during the quarantine period. Please clarify if this is correct.
That is correct. That is per CDC guidance. All employees designated as essential, as restaurant workers are, may return to work if they're needed and they don't have symptoms and they have to wear a mask. We're checking on them daily. They're part of our case count, so we're checking on them daily, checking in to make sure that they're compliant with that. This was done in order to keep these services going. Hospitals, again, essential services, asymptomatic hospital employees in a mask may continue to work during the quarantine period.
Another question from Alan. Would it be possible for the daily updated figures on the website to include the numbers for hospital beds, ICU, and ventilators? Many readers feel this is all that will convince them we are having a serious problem.
I understand people's desire to have more information, and quite frankly, we're providing a lot of information to the public, and adding more data to be updated daily is really not something we currently have the capacity to do, unfortunately.
And again from Alan, what impact do the traffic lights have if we are following the state plan? Has anyone considered getting a ruling from the state as to whether we have to follow that plan for liability reasons, as our local law director's office has opined?
As you're aware, our local law director is our law expert to advise us here in Knox County and well-versed in state and local law. And so that we're relying on their guidance, excuse me. And so we have not reached out to the state because we have our local legal expertise to advise us here. So we're relying on them. So the Board of Health will be deciding how we use the benchmark data and information going forward. As the law allows and as the law department has opined, the Board of Health has that authority to make a decision about how we move forward or don't move forward or what that looks like. So that lies with the Board of Health. They voted to keep the benchmarks and keep using them to make decisions, which is why they're meeting every 2 weeks.
From Megan with WBLT, several of our viewers have expressed concern after seeing Wednesday night's video of the county budget meeting in which most officials appeared not to be wearing masks or maintaining 6 feet of distance. Can the health department provide any explanation or guidance about this?
People make personal choices about maintaining social distance and whether they wear a mask, and people made personal choices that evening also.
From Shannon with WBIR, we're seeing again today a rise in hospitalizations, and we know our positive case count has been steeper lately. Is it time to take action today? Can we wait until the Board of Health meeting next week to make decisions about taking action?
The Board of Health is the authority they have the authority to make decisions about what we do locally. So we will be waiting until that meeting. These trends don't change all that fast. If you notice, our case counts are going up and down. Again, as we reviewed, hospital capacity is quite adequate. They have not activated their surge. If you look at the bottom of that graph of that section, you can see how much surge capacity they have, and they haven't even activated that. So they have a lot of tools in their toolbox to manage that. We'll continue to look at case counts. And I just want to go back and remind our community and honestly just empower our community and business owners and whoever you are to choose to follow the 5 basic plan or basic ideas, guidelines. Maintain social distancing, wear a mask, stay home if you're sick, wash your hands regularly and clean surfaces regularly. Those are tried and true, proven prevention methods. And if we all do those, if we all choose to do those, then we will make a difference. And, those of you who are, have those difficult conversations with your neighbors or family members, even family members. And if you go to a business that's not following the guidance that's written, you can choose to not patronize that business.
Shannon's follow-up question, she asks, is there a way the Board of Health can be called to an emergency meeting, or could this be delayed by having to follow sunshine laws?
Following sunshine laws would make an emergency meeting difficult. I don't feel like we're in an emergency, and I don't believe we need an emergency meeting. We continue to watch the data. We continue to pay attention to the data. And, if you look at, our hospitalization rate has been so low. That moving up to 12 seems really huge, and it's concerning, But I'll go back to, what the key to this is really the community following the 5 basic principles and doing it across the whole community, not sporadically.
From Vincent with the Sentinel, yesterday Charity mentioned that some cases were being spread without known contact with an active case. Is this community spread?
Yes, that's absolutely community spread. We definitely have community spread going on. We have some clusters, but the clusters are not the making up the majority of our new cases. This is community-wide spread. So what that means to you is that as you go about your daily life in Knox County, that you are at risk of contracting COVID-19, no matter where you are or who you are. I will also remind people that the length of exposure and the type of exposure is important. If you're less than 6 feet away and not wearing a mask and you're there having a conversation with your neighbor in the street who you know and you think they can't give me COVID and I can't give them COVID, you stand there and talk for more than 10 minutes, you might have just given COVID to somebody unknowingly, because we do know some people are asymptomatic. So it's really important that we're consistent about following those guidelines, even in the places where we feel safe, like our neighborhood, and we wouldn't think our neighbor would intentionally, make us sick, and they wouldn't. But we still need to follow those guidelines, because you can't always tell if somebody's sick, and people also transmit the illness before they become sick. So it's important to always follow the guidelines.
Also from Vincent with the Sentinel, bed use and ICU use are at over 70% utilization. Is the hospitalization benchmark primarily based on ventilator access?
No, the hospitalization benchmark is based on bed use and ICU and ventilators, all 3 of those for COVID-19, but also at that capacity piece. That I want to draw everybody's attention to that bottom piece that talks about their surge capacity and their ability to change that. Again, they haven't had to do that. This is not unusual for hospital capacity to be where it is now. The general public doesn't see that data, hasn't been seeing that data, and now we're seeing it. And so this is not unusual for the hospitals to have this level of occupancy. And so again, in talking with them, they feel like their capacity is adequate, and they know their business and they know their capacity much better than I do.
From Shannon with WBIR, the asterisk associated with the testing benchmark, which recently moved to a red light. Can you explain the qualification? Are we seeing fewer overall tests, but more people testing positive?
So actually, so the data that we have shows fewer tests. The asterisk is there because what we understand from talking with the state is that the large volume of testing that's happening is slowing down us knowing about the number of negative tests. We know about the positive tests, we get those, we're good with that, but us knowing about the negative tests, that piece is not as accurate. We've talked about, this was early on, we talked about this as well. That piece is not as reliable. So we want to be transparent, and that the numbers are what they are. We believe there's more testing going on. We know we're doing more testing. We know our hospital partners are doing more testing. We have seen, I think anecdotally, because we don't have all the testing volume, we don't have the N, it's hard for us to say what our positivity rate is. That's a challenge, because we don't have that reliable N to be able to say, the denominator, to be able to say, this many people have tested and this % of people are positive. The state does track that because they see all the tests. We just don't have a good, reliable way to do that. But again, it goes back to that system that was set up to let us know about positives, and that's working fine. It's the negative piece that's different and new, and it's not working as well.
From Shannon with WBIR, if a child at a summer day camp tests positive, what would KCHD's recommendation be to camp operators? And is there a best practice for managing the spread and cleaning?
So so many things, so many variables go into what our recommendations are. And that's why we have experts who are going to be calling the family and the camp operator, getting all the details of exactly what happened. So my ask for a community is when one of our experts calls and they're asking a lot of questions that seem like, why do you have to know all these details? We do. In order to provide good guidance and reduce the risk to other campers, to the community, to other families, we have to know the details. And that allows us to provide good guidance, get the people at risk out of the population, put them in quarantine, and ask them to stay there and check on them every day. get those cases out of the population, put them in isolation, check on them every day. So it's a big part of what we do to reduce risk for our community. The whole purpose of contact tracing and all those bazillion questions we ask is to stop the chain of transmission. When we can stop the chain of transmission, we will successfully slow down the spread of this disease.
From Jordan with WATE, this week we saw several of the largest one-day increases of positive cases. What are your concerns with this development, and will you be rolling back any reopening guidelines?
So rolling back reopening guidelines is a decision the Board of Health will be making if that's what they want to do. That's a decision. What we do with the guidelines is the Board of Health's decision. We are concerned. We're very concerned. It tells us several things. It tells us that the virus is still very present in our community. And you know, observationally, we all see that not many people are wearing masks. We're really happy with the people who are. Not everybody's maintaining social distancing. So it's kind of a hodgepodge across the community how that looks. And so it's allowing for spread. When we interview people, we find out that people aren't following social distancing guidelines and aren't wearing masks. And that changes what we have to do with those close contacts of that case, whether those are going to be, or whether those are followed or not. And again, you know, I want to really encourage business owners and citizens to be empowered to make decisions that protect employees and their patrons and the general community.
From Shannon with WBIR, Texas and Florida are closing some businesses again effective today. And we expect Knox County to make a similar move. Is that something we can enact on a local level while under the Tennessee pledge?
So Governor Lee has an order that does allow local health departments, the counties that have local health departments that are called metropolitan health departments that are independent of the state, to make different decisions. But again, that will be a decision that the Board of Health will make next week.
All right. It appears that Jordan and Megan, you both have a similar question there. So if I'm not asking one and it doesn't answer the other person's question, feel free to type in the second part. Jordan with WATE and Megan with WBLT both asked, a local woman has found it difficult to get tested at local hospitals. She said her family was turned away because they didn't display any symptoms and were not deemed, quote, sick enough to be tested. Are local health providers being directed to only test people who look sick?
Local health providers make their own decisions on who they test, but we don't have any direction for them. The testing that we're doing, there's no screening involved. It's free. It's open to anyone. So if you want to be tested, you can come down. You expect a wait. Our volume's gone up. Our staff is working really hard and as quickly as they can. But again, there's some information they have to get from you and it takes some time. But again, we don't dictate what hospitals and doctors do. They make those decisions internally.
From Brandon with WUOT, to get a refresher on the types of tests available, we're familiar now with the nasal swab PCR tests, but less invasive saliva tests are becoming available. As far as we know, are the saliva tests returning reliable results?
The saliva test, I'm not sure what saliva test you're talking about. So the only two tests that are reliable and can be used for diagnosing COVID-19 are the nasal swab and the oral swab, which is not really a saliva test. Again, it's looking for the same DNA, because there are some saliva tests that you actually get a sample of saliva, and those, I'm not aware of those being accurate. The other one's a swab that goes into the back of your throat, your oral pharyngeal cavity, and gets the sample from back there.
From Alan Sims with Inside of Knoxville, a reader reported that the workers in the front of the health department giving out masks were not wearing them. Is this accurate, and why would this be true?
It is unfortunately accurate, and we are addressing it. Actually, okay, we are mandating that our staff wear masks, and if they don't wear masks, we will follow our usual procedure when somebody doesn't follow a policy internally and deal with that.
From Claire with WUOT, about how much time should people plan to wait if they come to the health department for testing?
I'm sorry, that varies a little bit. Sometimes it's not long and sometimes it's an hour. I think our max wait has been up to an hour and a half. I think I'm not down there doing the testing, so I can't say. But it just varies with the time of day and how many people show up during that time of day.
From Megan with WVLT, Is there any evidence that the weeks of protesting has contributed to the rise in positive cases?
I don't think we have any evidence connected to any protests.
Any other questions? Please go ahead and submit them into that chat feature now. All right, we're not seeing any other questions come in, so thank you all for joining us. We hope you have a good rest of your day and a good weekend, and we will see you on Monday.